And of course, the structure is important in terms of that transformation or that other microstructure changes the properties of these systems. We can have different mechanisms to cause crack resistance. Some of these may be where we have secondary particles where a crack has to go through them, the residual stress. Some of them where the microstructure causes the crack to make different crack path through them systems. Here are the lithium disilicate materials, and you see the crack has really had to make this tortuous path around these crystalline bases. Here is the case of the aluminum material, and again you've got these, what we call these bridges, that are blocking the crack and making it more difficult for a crack to extend through that system. And then we talk about the zirconia system, and I'll talk a bit more about that in a minute. So, here is the exciting issue. We've gone from these relatively modest strength and toughness materials here to the very high strength and high toughness materials here. But, as I said, the aesthetics are better for these than they are for these. So we don't get everything for nothing. We have to match and utilize these different materials appropriately. Now, why is zirconia so tough? And the reason for that is that we have this process whereby we have this tetragonal grains. These little grains in this structure are tetragonal structure, and these are what are called metastable. And when we have a high stress field around the crack tip, these tetragonal particles are under now high tension, and they transform from a tetragonal structure to a monoclinic structure. That monoclinic structure is bigger in volume, and so now this closes the crack. It squeezes the crack closed, which then makes it more difficult for the crack to propagate. So here is an example of this type of structure here. Here are the grains that are all tetragonal. Here are the ones that are around the crack tip that have transformed from the tetragonal structure to the monoclinic. And here is where the crack is being closed up in that process. That is okay, provided it takes place when we want it to occur around a crack tip. But if it occurs in other instances, for instance when it's in the mouth under conditions such as water and other things, then this can be causing a problem for us. And if time permits, I'll discuss that with you. Now, why is this attractive? Well, this is attractive if you wanted to make a 4-unit bridge for a patient in your selection of materials, then you could go to the Empress 2. You saw this was reasonably high strength materials. You could go to an Inceram zirconia, such as the Vita material, or you could go to this, the zirconia-based structure. And when you put those and do these tests, we plot this in terms of a Weibull structure. This is the probability of failure versus the load, and you can see the load up there. Now, if you've got a big bruxing person, then you may have problems of having loads up in this area. Whereas if you've got a very mild and modest biting person, then you may be able to be healed. So then it's a question, what probability of fracture do you want? 1 in 100 of your patients returning? 1 in 10? So here is where we have a 50% probability here. So we can come out to here and say, well, under that conditions with the Empress 2, if the biting forces are above 350, 400 meganewtons, we will get 50% of the samples fail. Whereas in the case of zirconia, all of them will survive. So again, it's this question of being able to use the material on the basis of probability of failure. Now, there is a problem with zirconia. This problem has occurred in the orthopedic industry, and it almost killed the use of zirconia for orthopedic applications. 350 people had hip balls made of yttria zirconia, exactly the same as you're going to use with patients. And they all fractured. This was in 1 or 2 batches of material. These failed. And this happened about 7 or 8 years ago. And all of these materials failed because, not when the person was an athlete and jumping around, but they were lying in bed or sitting down, and all of a sudden a whole hip ball that they had in their hip completely broke. And the reason for this is that Under moist conditions, if the grain size is not correct, we get the tetragonal transforming to monoclinic. And now, if this is around a spike, for instance, in the orthopedic conditions, around the Morse taper and the system, because we place the ball over the top of that, if this occurs on the inside, then it's like a pressure vessel. It's getting more and more pressure as this transforms, and these cause these systems to break. This is a worry I have with zirconia being used for implants, because a lot of people are interested in this process, but with an implant, this is likely to be there for 20, 30 or longer years. And so this question of does this process occur is very, very important. And why does it occur? Tetragonal structure is what we call a metastable structure. It is not the most stable structure. We have high temperature cubic phase, intermediate region tetragonal structure, and the stable structure is the tetragonal phase, the monoclinic phase. So it really would prefer to be monoclinic, but we trick it by amount of yttrium oxide and grain size to stay in the tetragonal structure. But if we add water and moisture, just sounds like the oral environment, this can cause this transformation to take place. And this is a little bit like a cancer. It enucleates at one location, and then the stresses generated from that can trigger this transformation to grow and to grow. Now, if the grain size is small, then this may take 100 years to happen. But if the grain size is large and under stress, this can take place, in the case of the orthopedic application, within 2 years. So it's extremely dependent on microstructure. And you really should be very careful of your selection and sourcing of zirconia on this basis. Okay, I want to now look at, why are some of these systems failing? And these are taken from my colleagues. This is Peter Chung, was a former PhD student with me and a clinician, and this is some of the issues that he was seeing. Procera systems and luminous systems, completely fracturing of a crown that was put onto these systems. Another case where, for instance, again, an luminous system placed on I think it was on an implant system, and again we see this system failing. But notice where it is failing from. The fracture is occurring from the margin areas of this system, not in the occlusal surface, but in the margins, and that crack is extended across the top of that system and cause it to fail. Here's another example of an alumina system that failed after something like 4 years. And again, this was by some people in Geneva, and they found that this happened, and they were able to take out their sample and have a look at it, and what they could see is that they could then understand where the crack initiated from and grew in that system. And what they noticed was that there was a small little chip that had been placed during the initial placement, as though the porcelain on the outer surface had chipped slightly, and you could see now that was a much narrower region of around the margin of that system. That thin margin, now under the loading stresses and what we call hoop stresses, these are like the stresses in a drum. If it's under pressure, that can initiate the crack, and then over the course of time that crack grew up and across, and that material completely failed.